this is a sheep heart, which is similar in size to a human heart. This would be the apex because it is pointed, and it holds most of the left ventricle. And across the top here would be then the base. And all of the major blood vessels then exit from the top. Some structures on the outside of the heart. This is the anterior surface. And this right here, depression, is a sulcus. And it is called the anterior interventricular sulcus. And it separates the left side from the right side. And the white that you see here, this is fat. And the brown that you see here is muscle. And if we were to squeeze this, you'll notice there's the right side, this is the left. The left is harder to squeeze. It is thicker in comparison than the right. The right I can get in there pretty good. The left I can just slightly move because the myocardium is thicker on the left side because it pumps the blood to the whole body, where the right side only goes to the lungs, which would be here on either side of the heart. On top, so now we have a superior view there. We're looking top down. These little projections that kind of look like, I don't know, floppy, wrinkly cauliflower, right? I don't know, are called auricles. And they are on the top, and there is one on the left side. There is one here on the right side. And again, they're a darker substance, darker color. And they are overflow chambers for the right atrium and the left atrium, respectively. Okay, so they're teeny tiny little, they're hollow because eventually here I'll show you, you can put blood inside them. Blood will fill. And so the extra blood after it comes back from the left side of the left lung into the left side of the heart, extra blood can be stored inside this portion here, which is an auricle. Auricle ear. So it looks like an ear. And this is the right auricle. It's covered by some fat, so you can't see it as easily, but that is the right auricle. Again, we're looking from the front. On the back, this is the back view here again. Very thick, larger portion here makes up most of the apex left ventricle. On the right here, right ventricle, posterior view. Along here, there is a division. There is another sulcus that encircles the top part of the heart. It's called the coronary sulcus, like where a crown would sit, right on the top. And interestingly enough, it is the division between the atria and the ventricles. Coronary sulcus. Now, you see another vertical division, and it's the counterpart to the one we looked at on the front. This is the posterior interventricular sulcus. There are blood vessels that would run inside here. It's a very superficial depression, but it holds blood vessels and helps to feed the heart tissue itself. So interventricular means between the two ventricles. Right ventricle, larger left ventricle. All right, so now we go to a fun part, which is identifying the blood vessels. So this has been packaged, so I'm just gonna move it around a little bit just so I can see, whoops, what we're looking at. And I'm gonna remove some fat there so I can get to it. And the fat is just there too. Okay, so we're gonna look at our blood vessels from a posterior portion, right? This is the left side, this is the right side, top and bottom, or base and apex, and all the blood vessels come out from the base. You want to move your heart around when you're looking at it because the vessels get collapsed and it's hard to identify the structures. The most anterior of all the blood vessels is the pulmonary artery. Okay, it's the most anterior, it sits in the front. Okay, and this would be it here. It's still pretty much, it's collapsed from being packaged. But if I stick my finger in here and I follow where the tube goes, it's going to point to the right side of the heart, the right ventricle. So the blood comes up and out of the right ventricle through the pulmonary artery. It'll split eventually and go to each lung to take that comparatively deoxygenated blood to get reoxygenated in the lungs. So most anterior, very large vessel, pulmonary artery, pulmonary trunk here. Arteries take blood, always take blood away from the heart. Okay. Now, sitting on top is the largest of the arteries, and that's the aorta. And here, as I open this up, you can see this one is on top. And it's connected to another vessel that will split or bifurcate from it. This is the brachiocephalic. And so you can see it's one continuous piece because the brachiocephalic connects right to the aorta and then branches, and eventually that will become part of the vessels that feed your shoulder and then down your arm. Okay, the brachiocephalic. All right, but this is the aorta, and if I were to stick my finger in this way, I can't go this way, I'm blocked. But if I go this way, it points to the left ventricle, and that's where the blood comes from. The left ventricle comes up and out of the aorta and then out to the body to feed the tissues, because this is the reoxygenated blood. Okay, so here are our auricles from the back. Left auricle, there's that right auricle that's covered partially by fat. They are overflow chambers to the right atrium. This structure here that's behind the right auricle, this is the superior vena cava, SVC. It brings blood back that's been used from structures above the level of the heart, the superior vena cava. And it will empty that into the right atrium, because all blood eventually, when it's returning from the body to the heart, all of it empties into the right atrium. So it goes right into, see, there's the auricle, the overflow chamber right there. Okay. And then if my finger goes down, that takes me into the right atrium. Okay. Now, below, because they both end up in the same place, this opening here, this is the inferior vena cava. It would be a large blood vessel that would come up this way behind the heart and pull the blood that's below the heart, return the used blood again back into the same chamber on the right atrium. One more vessel that we're going to look at. So we've got pulmonary artery, aorta with its attached brachiocephalic, superior vena cava, inferior vena cava. We have one more here on the right, or on the left, excuse me. And this will be, let me find it, there we go. Really gaping, large hole there, isn't it? Mm-hmm. It is the pulmonary veins. Pulmonary veins. Veins always take blood back to the heart. Pulmonary veins. And so this is an opening where, as you can see here, I'm going into the left auricle, which is the overflow chamber, and eventually into the left atrium, because the veins, of which there are four pulmonary veins, bring highly oxygenated blood back from the lungs to the left atrium, into the left ventricle, and then out through the aorta to the body to supply it with oxygen and nutrients for each of the cells and the tissues. So those are all the blood vessels that we are going to learn. Again, pulmonary artery is the most anterior, it's in the front there. It brings blood will come through it from the right ventricle. Aorta, which brings blood from the left ventricle, and it's usually connected to the brachiocephalic, which you can see there, it's one continuous piece. Then we have the superior vena cava behind the right auricle. that brings blood that's been used back, has waste in it, to the right side of the heart, the right atrium, and its counterpart down here, the inferior vena cava, brings blood below the heart back to the right atrium. So it can get recycled and reoxygenated. And last but not least, the pulmonary veins bring blood back that have been reoxygenated from the lungs to the left side of the heart, which will go out and feed the tissues of the body. So we're going to identify some structures inside the heart here. I've made a cut that is a coronal cut or a frontal cut. So I have a slice here between the front and the back. And this has put us somewhere around the middle, actually, so we can look at some of the typical structures that we'll see. So 3 layers to the heart. Excuse me, the outer layer here is kind of continuous. You can see a very slight line. That would be the epicardium, right? And then you see the fat on the outside. What makes most of the heart up is muscle, and that would be the myocardium, and that's this red-brown color. Now, the endocardium is this very thin layer that you can see that I can slightly probably pull apart there, pull over from the top. It lies, it's 1 cell thick, and it lies right over the structures so that the blood, as it flows through, it's a very smooth, slippery surface, and it doesn't get sticky, it just slides and glides over it. That would be the endocardium. So epicardium, myocardium, endocardium, that thin, translucent, if you will, it's not completely transparent, but translucent layer, 1 cell thick. And that covers the valves as well, so that it all slides inside and inside the blood vessels. Okay. Between the left and the right ventricle and atria up above, we have valves. And on the right side, and this is the right side, you can tell because it's smaller, and this is the left side, it's much bigger in comparison. This section here is the interventricular septum. A septum divides 2 chambers. So this is the left ventricle, this is the right ventricle. You can see that the left ventricle is a lot bigger than the right ventricle, although they hold technically about the same amount of blood. There are 2 valves that are at the same level between the atria, which are at the top chambers. Remember those teeny tiny chambers that just hold the blood temporarily. It's just a holding tank for blood while the ventricles are contracting. So there are what they call AV valves, atrioventricular, between the atria and the ventricles. They are designed very similarly, but they have one thing different. Now, the way I cut it, you can't see the difference, but you'll know just because of the size of this chamber compared to that chamber that this AV valve is indeed the tricuspid valve. Tricuspid is in 3 cusps, okay, or 3 leaflets that make up the valve. On the right or on the left side of the heart is the bicuspid valve. It only has 2 leaflets, and here's one of the leaflets. You can see this connective tissue, one of the flaps. There are only 2 flaps on the left side, 3 flaps on the right side, and I have cut through them so it's hard to see. How you know it's an AV valve as opposed to a semilunar valve is because of, number 1, location. Number 2, it has all these little stringy things attached to it. And the stringy things are called chordae tendineae, little tendiny cords that connect to the leaflets and then connect to little muscles down in the ventricles. So the muscles that move the valves leaflets are located down in each of the respective ventricles. Now I want to show you this one because it's larger. This little projection right here that connects to the chordae tendineae, cords, you can see the little cords there, is called a papillary muscle. When it contracts, it causes these leaflets to tighten, and that prevents then the blood from going from the atria to the ventricles. So in the walls, now this is the myocardium, you can see the muscle. In the walls of the myocardium, only in the part of the ventricles, on both sides, you'll see this crisscrossing of the muscle tissue. It is called trabeculae carni. Remember trabeculae in your bone, your spongy bone that has spaces in between? Here you can see the little spaces in between, but it's called trabeculae carni. Carni is in meat, meat is in myocardium. And so the walls of the myocardium in the ventricles only have this lattice work, this crisscrossing effect called trabeculae carni present. This opening right here is the aortic valve. It is a semilunar valve, and the pulmonic semilunar valve and the aortic semilunar valve, the second set of valves in the heart that eventually connect with the arteries that carry the blood out of it, look exactly the same. So if I just cut this out and put it here and asked you to identify it, you couldn't. You can only identify it seeing it where it is normally located. And so here is the tissue, right? Part of the bicuspid leaflet, but below that is the ventricle. And this is, of course, the left ventricle. And so the blood, as this muscle contracts, it has a ringing effect from the apex clear on up to here, which is the aortic valve. And then it comes out where we saw earlier through the aortic valve, out the aorta, which is the vessel that sits right on the very top of the heart, and then out to various arteries that distribute the blood to the whole body. Okay, so one last structure that we need to identify that is unique now to the atria as opposed to the ventricles. This, remember, is your right auricle, that brown overflow chamber. This is right here, the right atria. This would be the back surface of it. And up here on the front surface of the atria, and it's only located on the front surface of each atria, is a muscle. Much like we have the same muscle, a muscle by the same name on the front surface within our chest cavity, this is called the pectinate muscle. And it lies on both the left and right atria, just on the front surface. So it's a muscle that helps with contraction of the atrial wall to finish pumping the blood into the ventricles so that they can move through their respective systems to do their jobs. Okay.